I'm Mallory Earley, a Senior Risk Resource Advisor with ProAssurance, here to share some information about telemedicine and the informed consent process. Before beginning telemedicine or telehealth encounters, take time to adequately explain the nature of this type of treatment and obtain proper consent from patients, especially in emergency situations where telehealth is preferred, like the COVID-19 pandemic. State regulations vary regarding specific requirements for informed consent for telemedicine visits, so confirm specifics with your state board, but the best practice is to inform your patients of the material risks associated with this treatment platform and document that in the record. More specifically, first determine in advance whether or not the patient's complaints or condition to be treated is appropriate for telemedicine. Because you will not be physically in the same room as your patient, there could be technological limitations that prevent you from getting the information you need to make effective treatment decisions. If you determine telemedicine is appropriate, tailor your informed consent forms to the services that you offer, generally covering the benefits of telemedicine with explanations of how the visit will take place, such as live, two-way audio, and video. Also consider explaining how a condition may worsen or when to seek emergency care. Explain security protocols that are in place to protect patient and confidentiality and limit unauthorized access. Think about solutions for other risks associated with the technology, such as poor service or connections, interruptions, and other technical difficulties where the technology or equipment fails. Also consider others may be present during the telemedicine visit for purposes of operating AV equipment, so give the patient the right to request that non-medical person leave the telemedicine examination area. Let patients know that your evaluation notes will be sent to the patient's primary physician or provider if that is not you. To help inform patients about the risks, benefits, and alternatives of telemedicine visits, consider emailing the informed consent documents when each appointment is made and obtain a signature prior to the visit. Then review the risks at the beginning of the telemedicine appointment and document the review and patient consent in the medical record. Telemedicine can be a helpful tool in patient care when the participants fully understand the benefits and limitations of the format.